CAIRS for keratoconus. What is CAIRS? At the beginning, I want to show you what is CAIRS simply, in a simple way. It is a corneal allogenic intrastromal ring segment, and it is a biological alternative to the synthetic intacs, and uses the donor corneal tissue shaped into actually a half ring, not a complete ring. It is a half ring of the corneal tissue. And the advantages of CAIRS, it is better biocompatibility because it is better biocompatibility because it is allogenic, and it reduces the risk of extrusion and infection and preserve the corneal structure. This is the advantage over the another keratoplasties, and can be combined with cross-linking. When to consider CAIRS? Actually, we cannot use CAIRS for all cases of keratoconus, but when we have progressive keratoconus with a visual deterioration, we can consider CAIRS, and contact lens intolerance patients, we can use CAIRS for them, and unsuitable for synthetic rings. And early, it is not for the severe or advanced keratoconus. It can treat early to moderate keratoconus stages. And the patient selection criteria, actually, the age, we have to select adult patients, and the corneal thickness, it is better to be 400 micron or more. In the ring area, we are planning to implant the CAIRS into it. And no active ocular infection, of course, and stable or treatable ocular surface. The preoperative assessment, we use topography and tomography analysis. Usually I am using the pentacam for assessment, and visual acuity measurement, corneal pachymetry mapping. This is also from the pentacam, and patient counseling. Surgical procedure steps, I will show a video explaining the whole surgical procedure steps. The stromal tunnel is created by the femtosecond laser. Usually I'm using the intralaser femtosecond laser machine to create the ring, and the allogenic ring segment inserted into this tunnel. The segment selection based on the segment size and shape, it is based on the topographic data and the severity of the keratoconus and the K readings, K max. The careful centration is very important, and placement of the segment. The post-operative management, it is like any other keratoplasties, but it is have a better visual rehabilitation and shorter rehabilitation period compared to other procedures. The visual outcomes, it will improve. A lot of patients, when I tell them about the CAIRS, they are asking me, Doctor, is it visual like the refractive surgery? I will get rid from glasses. No. Actually, it is improving the both corrected and uncorrected visual acuity post the procedure, especially in mild to moderate patients. Usually they cannot get benefit from spectacles before the operation, but when I do CAIRS for them, the astigmatism become more regular, the corneal surface become more regular, and they will do better with their spectacles. And also reduce corneal steepening, and better contrast sensitivity to the patient, and enhanced quality of life. And the refractive and topographic changes, it flattens the corneal curvature, especially at the cone area. Till now, I'm not using double rings. Usually, I put only one ring at the steep part of the cone. More regular corneal shape after the surgery, and lower higher order aberration. Safety for the procedure, it is minimal risk for has minimal risk for rejection due to its allogenic nature, and the segment doesn't contain endothelium, and low incidence of extrusion and migration when you fit the tunnel to the near to the size of the CAIRS segment, and no significant corneal hazing or scarring, and it has the good healing profile. I will show you the video. This is the machine, the intra-laser femtosecond machine. I'm centering the area of the tunnel, and my machine do only one opening, and I need to do another opening manually. And after that, I'm using the corneal graft and using the double trifine punch. This is the double trifine punch. According to the patient, it have different sizes. And I'm using the manually to shaping the length and to customizing the shape of the CAIRS segment. And I'm introducing the CAIRS segment without drying. It is a bit difficult, more difficult than when you dry it, but I used to insert it without drying, and I can do this. And after that centration, also I am using marking to know the upper from the lower. And after that, massaging. And usually I combine the procedure with the cross-linking. At the end of the procedure, I'm doing a cross-linking to the patient. So this is the result. These are the patients post-operative after 2 or 3 weeks. We have a good shape of the cornea, good shape of the eye. I just put these videos to show you the result after the operation. It is very good shape of the eye, acceptable, no contrast, no sutures, clear cornea. And these are other patients. Usually, as I said, I am putting one segment at the steep area of the cone. And these are some examples of reduction in the refractive, autorefractive of the patient. So you can see I did the left eye for this patient. It was -7 sphere and -125 cylinder. After the operation, the -7 is reduced to 2.25. And this is at the bottom, it's the pentacam shape. This is another patient. Also, I did both eye of this patient, and you can see the reduction in the refraction of the patient, in the myopia, and in the astigmatism, become more regular cornea. And this is the difference map of the patient. And this is another patient also. He has 6.5 myopia and 5.5 cylinder. And after the operation, there is no significant decrease in the myopia or in the cylinder, but the cornea become more regular, and he can see better with the spectacles. The vision improves with the spectacles from 0.3 base corrected to the 0.6 base corrected visual acuity. And this is another patient with great improvement of vision. It was counting finger 1 meter and cannot be corrected with the glasses. After the operation, it became 0.2 uncorrected visual acuity. And this is another patient. I just wanted to show you the great difference and the great effect on the life of the patient from counting finger 1 meter or 1.5 meter into 0.4 uncorrected visual acuity. And this is another patient from 0.05 uncorrected visual acuity to 0.5 and best corrected 0.7 after the CAIRS. And this is the summary. CAIRS is safe and effective option for treatment of keratoconus, and offers visual improvement and stability. And we need further studies in the future to make the procedure more effective and more productive. Thank you very much.